Good afternoon, everybody, and welcome to our Facebook Live. This is our second Facebook Live for Bellevue and Enkey patients about the new Rapid Health Patient Access System. My name's Lois Brown. I work with the national team of Modality, and I have with me today Dr. Ahmed and Maxine Rowley, and I will let them introduce themselves. So Dr. Ahmed, would you like to introduce yourself?
Sure. So hi, my name's Dr. Nazreen Ahmed. I'm one of the GP partners at Modality Birmingham, and I'm here on behalf of the Digital Access team.
Brilliant, thank you. And Maxine?
Good afternoon, I'm Maxine Rowley and I'm the Divisional Service Delivery Manager, and I'm supporting implementing the new system that we're going to share with you this afternoon.
Brilliant, thank you. So today we're going to have a presentation where Dr. Ahmed and Maxine will go through what the system will be like, why we're making that kind of change, and then there'll be opportunity after that presentation to be able to ask questions in the chat. So I encourage you, even during the presentation, put your question in the chat and we will try and answer as many questions as possible. Don't worry if you don't have time to stay and watch all of the video, or if you're joining us on catch-up, this video is recorded and it's there and you can watch it at any point going back to either YouTube or Facebook. And we're very excited to share this change with you. So I will get the slides up and we can start the presentation. Over to you.
Hi everyone, as I said, my name's Dr. Ahmed. I'm one of the GP partners at Modality Birmingham, and I'm talking to you today about our changes for access for our patients at Bellevue and Enkey Medical Centre. So just a little bit of housekeeping. This is a virtual meeting, so if there are any fire alarms, they are not here, they're not a drill, please respond to them. And as Lois had mentioned, this is being recorded, so if you do need to pop out at any time, you can catch up as it is being recorded and it will be published later. We will go through the presentation. The chat is live. We may answer those questions while we're going through it, but please do keep those questions coming and we will have time at the end to go through those with you. So next slide, please. So our new online booking system is going live on the 1st of October. I'm going to hand over to Maxine now so she can go through why we've chosen the system we have.
Okay, so we've done a lot of listening to patients and our staff, looking at our surveys that we collect monthly and annually, and we are looking at how we can improve our online access for you to help you to get to hopefully appointment of your choice depending on clinical needs, but also just to make sure that actually we are allowing a kind of fairer access as well to the system. This is not only going to help patients, but it's also going to help our staff as well, so that they might be spending slightly more time with you to ensure that you're signposted appropriately, and also to make sure that you get a good service on the first contact that you have with us. I think it's important, you know, we recognise that there are a lot of people that can't get through on the phone. There's a queue system, there's a blockage at 8 o'clock in the morning, and we've listened to all of this feedback. It's not only frustrating for patients, but it also causes our staff a lot of anxiety when they're trying to give you the best possible service and access. So yeah, we're hoping that the new system answers all of those questions. Next slide, please. So we've looked at the phones, and as you can see, this is for Bellevue Medical Centre, and this is between January and April, showing some of our phone data. So you can see our average calls per month are over 6,000. And we have to try and match all of those calls and signposting to the appointments that you might want to, you might need. If you move on to the next slide, please. So for Enkey, it is similar. They have approximately another 1,000 to 1,500 calls a month. They have a list size of probably 10,000 patients. And as you can see, we've received over 23,000 calls in just 4 months, which is a lot of phone traffic that we're trying to get through. Telephone data is just one part of the data we've looked at. We've also, like we mentioned on previous slides, has looked at survey and feedback. But this is just a small percentage of a way that you access our teams at site. We have to remember that there are also other areas of work that they need to deal with around descriptions and documents being signed, and that isn't only just for our reception staff, that's also for our clinical staff as well. Next slide, please. Okay, so our staff are really excited to be part of this change as well, and they're also very proud to belong to the NHS, and they want to do the right thing and make sure that they signpost you at that first contact, whether it's face-to-face or over the phone, or other areas like, you know, email traffic and that sort of thing that they're dealing with. I think it's really, really important that we help our staff to give you the best service that they can give you. And so they've done a lot of training behind the scenes to be able to be in the right place and to help you. So please bear with them when they are launching this new system with you. There might be some areas that calls might take a bit longer. So we do ask for your patience while we're implementing this new service. This new service is not only just about kind of a fair access, but it's also part of our NHS contract. We have a lot of people that already use the NHS app. It varies between 34 to 52% across the division. And that allows you to have ability to look at your medical records and order your prescriptions and that sort of thing. So we're seeking the digital access to help us provide you with a better service. Next slide, please.
So, thank you, Maxine. So as you can see, there are a lot of challenges that are facing general practice. Just the telephone data alone shows that there's a huge amount of people needing to be seen, wanting our help, and accessing us and trying to access us. So there is that 8 a.m. rush almost every morning for people to try and get an appointment. That causes a lot of stress on the system. There's a lot of delay that we saw in the feedback, and patients being held up in queues, not getting an appointment at the time that they can make. And you know, there's not a lot of patient choice. So it was clear to us that this is not a sustainable service. Our patients are getting frustrated. Our staff are getting really frustrated, being not able to help as the way that they would like to. So we thought that we needed to have a look at a better solution. You fed back to us that you couldn't always come and see us on the day that we offered. You had family commitments or work commitments or other reasons why you needed to come and see us at another time, but that's not always possible. So we wanted to find a solution that worked, that allowed you to book with the right person at the right time that suits you and the clinician and the clinical problem that you had. Next slide, please. So what did we do? We, as a team, wanted to find the right solution. So we looked at lots of different systems that were currently being used by other teams across the UK who were facing a similar situation to us and had found a way through. So we had some meetings, we discussed it with our patients and our partners to find a better way. And our aim was quite simple: to simplify appointment booking, to suit our patients and to give patients a safe choice. Next slide, please. So after looking at lots of options that were available, we decided to go with an organisation called Rapid Health. And there were several reasons why we chose Rapid Health. First of all, it is NHS approved, so it fits all the safety regulations and governance that are required for online digital tools. It is web-based, so there's no need to install an app or have a password, and so it makes it a lot easier to use. You can access it directly through the internet via the practice website, and there will be a link there, and it is available 24/7. All you need to access is your date of birth, your name, and your postcode, as well as a valid email and telephone number so that we can contact you. It is not just an online booking service. It offers the patients a choice of appointments of days and times depending on the clinical problem that you have. It can also offer a choice of clinician depending on the problem. So that means that we can offer you the right person at the right time. Furthermore, it is safe because if there is not an appropriate appointment available to you, your request will come back to us and the duty doctor will assess and advise that day. Next slide, please. So, some of you may remember e-consults. It was a great service in a way. You got to give us the information that we needed to understand what your problem was and how to help you best. The difficulty was that a doctor had to read through each and every one of those e-consults to make a decision as what might be needed. Some days there were more than 200, which is difficult to manage and actually took doctors out of giving appointments because they were busy dealing with the e-consult triage. And that just reduced the number of appointments overall. Some of the other systems that are available do a little bit more, but they still need the practice to book the appointment at the end. So the program that we have chosen, Rapid Health, the organization actually, the system of questions that they ask help us identify the urgency and the need for the appointment, and it allows the patient to directly book that appointment at the end of the consultation. So that gives you the choice of telephone consultation or face-to-face if it's appropriate, because sometimes you do need an examination. And it allows you to book that appointment depending on your diary and what you can make. Okay, next slide, please. So this is exactly what the system is. It is safe. It identifies you using your name, your date of birth, and your postcode so that you are our patient. It works directly with our online system to be able to make sure that you are one of our patients. Through the questions that they ask you about your medical condition, it assesses and prioritizes your clinical need and allows you to book the appointment depending on that. It does this all seamlessly within one journey, and we really hope that it improves that patient experience and journey, and hopefully you will be satisfied with the outcome. Next slide, please. So other sites have been using this system, and they've used it for the last 5 years at some sites. What do other people think about it? Well, actually, most patients really, really appreciate this system. 77% of patients liked having a choice of appointment time and date. They found that the service was really easy to use and the questions were easy to follow and understand. And they found that the system was easy to access, which is really important because we understand that that's a really key thing in getting to see your GP. Nearly 70% of patients preferred using this system to book their appointments, and that's huge. Next slide, please. So how do you do this? When you decide that you might need to book an appointment, you go to our website. This is Bellevue's website, and Enki's looks very similar. If I show you the next page. Next slide, please. Yeah, so you click on the appointments information, and then in there will be a link on how to book your online appointment. And then you'll see this next slide, which says to book on medical request. Okay. So I'm now going to play a small video and talk you through that journey of how you will see it. Once you've clicked on medical service, medical advice, you type in what your problem you think you might have. So you can, the reading level is age 7. So if you make a typing error or you're not sure how to spell it, it will try and help you find the right pathway for you. So say for example, you put back pain in. If you click on show, it will show you if that's suitable for you, and you click select. Put in your date of birth. Now, this is a test patient, so the details are not a real person, so please don't worry about that. Click on their details as you are registered with us. So please make sure that you spell your name exactly how we have it. That's all fairly self-explanatory. The most important thing is that we need to have an email address registered on your notes. So if you have not yet done that, please contact your practice and we will add your email address to your record so you can use this service from next week. If you don't have an email address, please do contact us and we will talk you through a solution that might help you. Okay. So then we've added just our generic email address that you all know, and we just need a telephone number. It doesn't have to be the phone number that is registered to your details, to your medical record, but just a number that's best to contact you today about this. So click select. So then it talks you through what we need to do. And if you understand and happy to proceed, click on next. So then it asks you a series of questions, really trying to understand the nature of your main concern, where you've got the symptoms, why you've got the symptoms, what other, how can you describe it? When you look through these questions, these are really very similar to the questions that I would ask you as your GP. These are the bits of information that I need to know to understand how to help you best, really. So as you can see, it's very easy to click on them. You don't have to put any words in. You choose an option that fits best. So whether it's dull or shooting, or you're not sure, or not any of those, you can click on that as well. Based on the answers that you give us, it tries to choose the next appropriate question to ask. Just like I would, actually. So then you click on next and it does look like there's a few questions, but it's really important information for us to be able to make sure that we're giving you the right information at the right time. Some of the pathways take about 3 minutes, some of them take up to 5 minutes, but you can do this in your own time. To make sure that you are able to give us as much information as possible. So as you see, we go through the questions, you click on the options that are appropriate for you or that fit best. Brilliant. And we keep going. So as you can see, some of the questions are yes, no, not sure. So that then makes a difference to the next questions that are asked to you, because it will make a difference as to when you might need to be seen by, or if it's something that we can help you with in a different way. Keep going. So whilst it does recognize you as one of our patients, it doesn't access your medical history. So it will ask you questions that you might want to give that information so that we don't miss certain things that are important for you. So for example, if you have other health conditions. Okay, so once you've completed all the questions, it then processes your answers to look at what might then be the most appropriate appointment for your problem today, whether that is to be seen on the day, whether it's something that might be available to be seen tomorrow, and it will offer you the available appointments that are safe for your medical problem. Now, they won't be 1-minute appointments in real life, but this is just an example of how it looks. Once you've selected the appointment that you want to go ahead with, you click on confirm, and it will send an email to that address that you gave us at the beginning. In that email, there is also a link there for you to be able to amend or cancel the appointment if you needed to. And if you need any additional support, such as a translator, then you can absolutely contact the practice so that we can accommodate those. Okay, so next slide, please. So I hope that was helpful to see. I'm now going to hand over to Maxine so she can go through the rest for you.
Hi, so I'm going to go through what isn't changing. And it's really important that we have these exclusions so we can help manage the team as well to do all the work. So exclusions include appointments for under 16s. So you can still ring, make an appointment, and our reception team will ask you a series of questions, about 5 in total, so that we can ensure that we capture all of that information. Home visit requests, again, just call the surgery, and we will make sure that all the details are taken down and they will be reviewed, and then you will be contacted about a time for the home visit. Nurse appointments, so things like blood pressure checks, blood tests, smears. We currently do send out links by, and you receive my text messages, but they will also be, we will contact you, and you can also ring in and make those appointments, and we will book them for you. They're part of the planned care. Also, if you have any long-term conditions such as diabetes, asthma, COPD, we do have a recall and a review team that do send you letters, send you out text reminders, and pick up the phone and speak to you. That will continue. Other areas like NHS health checks, postnatal checks, and baby checks, we will continue with making the appointments in the same way that we currently do offer that service for our patients. Next slide, please. So here are our teams. This is Bellevue and Enki. They're here, they're ready, and they're willing, and they're trained on the new system. What will be different is that they will be asking you a few questions, especially if you are unable to access the online link or if you need help, okay? They will be asking you the same series of questions. They will also be able to give you some information and some patient leaflets that you can take away. And we do realise that for some people, online isn't an area that you can do, and we will always have a team on hand to help you get the appointment that you need, or to speak to the clinician, or to have a prescription request done. That won't change, but what this will do is free up time to make sure that we can help those people that absolutely do need it. Next slide, please. And we will also be promoting even more other apps that can help you. The NHS app, and also the Patient Access app, which takes you access to our clinical system, System 1. Those are still going to remain in place, so you don't need to worry if you have got access to that. Nothing will change. Those features remain the same, and we also do, for some practices, we're using Voice Connect, which is another system where you can pick up the phone and order your prescriptions online. That isn't going to change. So now I'm going to hand back to Dr. Ahmed.
Thank you, Maxine. So thank you everyone for your attention and engagement so far. It's been really helpful to be able to explain to you the new changes that are coming and what is staying the same. I wonder if now would be the opportunity to stop sharing slides, and then we can answer any questions that have come through.
That's great, thanks. We don't actually have any questions at the moment, but I can see people are watching, so please put your questions in the chat, but I'm sure we can think of some questions in the meantime. The first one that comes to mind is, how long will this system be available for patients? Will it be every day? Will it be available at weekends? How long will it be open for?
So I can answer that one. We are going to go live with the system on the 1st of October, and we're actually going to leave it open 24 hours a day. We want to hear what people are concerned about and be able to offer them an appropriate appointment for their concern, not just for those who can ring at 8 a.m. and are the lucky few who get an appointment first thing in the morning. So we're really hoping that our patients use it safely and tell us what they're worried about. And not everything may need an appointment, and we can try and manage to answer those questions and make sure that everyone feels that they are supported by their practice.
Also, so if I was a patient putting something in, and actually it's more appropriate if I was actually quite unwell to either call an ambulance or to A&E. How when I put my results in and those red flags come up, my symptoms and everything like that, how does the system react to that?
That's a really important question. Certainly, the questions that are asked, there are steps throughout the process that ask the patient, ask you, do you have any worrying symptoms? So they will give you an example of those. So, for example, chest pain, shortness of breath, severe bleeding, and if you answer yes, it will say, please, if you have any of these symptoms, please attend A&E. And actually you can click, yes, I will go to A&E. If you felt, actually, I don't wish to go to A&E, you have to tell us why, because we will be worried about that. And that response then gets saved and for the duty doctor to respond back to within 2 working days. So if it's something, say, for example, you've already been to A&E about, it is a pre-existing condition, and there are lots of reasons why sometimes A&E is not necessarily the right service for this problem, then that response will come back to the duty doctor to have a look at and make sure that you get responded to accordingly. So throughout the system, there are little pop-ups that say, if you have this, please attend A&E or please contact an emergency service, because this should not have an appointment with a GP. It would be appropriate to go to the hospital. Does that make sense?
Yes, definitely. The other sort of common questions that have come through that we've seen before is English isn't my first language. Or how would you manage that? Not only it might be your family member might do the appointment for you, but how would you as a practice know that they needed an interpreter? Or actually, how do I access it if it's not my first language?
Sure. Maxine, did you want to answer this one, or shall I take this one?
No, it's fine, thank you. There are a series of notes and questions for you to answer in the beginning. So if, for instance, you do need an interpreter, we would want you to carry on filling in the form or have that submitted. But there's an area where you can say that you need this, and this again will go to our inbox, where we've got a team of not only clinicians but non-clinical staff that will be looking to be able to support you to book the interpreter and book the appointment with you at set time, so that we've got the most appropriate time for you for your clinical needs.
That's good. That's good to know. So if you're in a family and you all use the same computer and the same, you have a shared, maybe a couple have a shared email address, how does the system handle that? I don't want my little brother knowing everything about my medical history.
Absolutely. No, so the most important things is when you fill in that first page is putting your details in, the email address and the telephone number. The email address is solely to send the confirmation email at the end of the pathway of the appointment that is booked. So none of the medical information will be emailed to you, but it will be saved to your record. So it's really important when you do that first part that you put your details in if the pathway is for you. If you're doing it on behalf of a family member, please put their name and their date of birth and their postcode. But that confirmation email may come to your email if you're doing it on their behalf and you're using your email address. But the pathway, because it's got the patient's details in it, will be saved to their record. So the clinician, when they come to do the appointment, will have that information ready to help them and help you.
Oh, that's good. That's reassuring, isn't it? So in terms of usage of the system, I'm if I ring up on the phone, they're just going to give me an appointment straight away, or do I have to answer all the questions?
So the questions are there are really to help us make sure that we give you an appointment at the right time with the right clinician. So, for example, if you came with a joint pain, actually you may want to see one of our physios who are much better trained at dealing with joint problems than a GP, and may be able to give you better and more specific advice for your concern. So those questions that we ask are not because we're nosy, it's because we want to be able to help you at the right time with the right person. For example, some of the other medical issues that you have may need a clinical examination. So we really want to see you face to face rather than trying to do this on a telephone call, because it's quite challenging sometimes to diagnose something without all the information, and that includes seeing you. And so that's why those questions can seem long, but actually they take 3 to 5 minutes. We would be asking you those questions anyway, but it gives us a bit more time to spend with you and to understand what your concerns are when you come to see us.
So when I book my appointment, and I might want to see a particular clinician again because they've been doing an ongoing concern for me, is that possible in the availability to select that?
So certainly depending on the clinical problem and the urgency, if that clinician is working on the days that are suitable for you, you will be able to choose them from the menu of appointments and the appointment types that you're offered. If a doctor has said, actually, I need to speak with you in 2 weeks, they can also send you a link to book directly with them.
Oh, that's good. So that's really reassuring about follow-up appointments, because sometimes patient can see someone, they say if you don't feel very well and whatever, and then you're worried about getting that next appointment. But that's good that they can potentially send that link or even book that for you at that point. I'm sure at that time.
Absolutely. So absolutely. So if they've they've said, let me know in 4 to 6 weeks how things are going, you can always submit another online form with your up-to-date symptoms. I'm going to be honest, sometimes it might not send an appointment to that particular clinician if they're not working on that day, but all that information will be there for our team to pick up, and we do work as a team for a reason.
That's good. Do you explain a bit about the nursing appointments and how that would work? And I know Maxine went over the slides, but I think it's important to reaffirm how if someone needed a healthcare assistant appointment or a nursing appointment, how that would be booked. Absolutely.
So our phones are still open. We're still here. Our PSAs, our reception team are still here to help our patients. We want to be able to try to prioritize as many people using the online system as possible. So it allows our reception team more time to help those who do need it. So if, for example, you need a blood test appointment or a smear test, please do contact us or ring us, and we will book that appointment for you over the phone or in person. When you've got a planned care appointment, so an annual review, you've got a diabetes checkup, we will send invites to remind you that you're due your annual checkup and you need a blood test or you need a nurse appointment to go through your medications. So you can use those links to book onto our system. Again, you can come into practice, you can give us a ring, and we will be able to help you. And we really hope that because our telephone lines will be a little less trafficky from people using this system to book an appointment with some of the clinicians, we'll have more time and we can answer those phones quicker for you to help you book those appointments.
That's good. That's encouraging. So I was going to ask Maxine this one. So on the front page, there's the medical request, which we talked a lot about, but there's also that admin request option in Rapid Health. What sort of things can patients request through that pathway?
So things that you could put through that pathway would be checking if your repeat prescription's ready for collection. It could be to see if your referral's been completed. It could be for a sick note. It could be that you want to know about service, actually. It could be as simple as you've seen something on our website and you want more details about a particular service, and we can send that information out. And also a lot of sort of self-help links that a lot of things in and around the communities are all self-referral links. And if you want any more of that information, we can make sure that gets out to you as quickly as possible.
It's good. So one of the questions that's has come up previously is that people have a fear that they're writing all their answers into the form, and it can be it's very personal stuff to them. And what happens, where does that land when it lands through into the system if they don't automatically get booked an appointment? And obviously all of our staff are trained in patient confidentiality, but do you want to provide some reassurance about that?
So the information from the questions come into your clinical record, and that is only accessed by the clinicians who are seeing you, who need to know that information in order to help you. So certainly it is not shared without your consent. And as you said, all of our staff are trained in confidentiality and GDPR. So that's really important that we can reassure you that your medical information is kept in the clinical clinical system.
That's good, thank you. So I'm trying to think of some other questions that have been asked. When you go live, what will happen to my existing appointments? If I've got an existing appointment, does that mean I have to go through and book an appointment with Rapid Health when you go live, or do I still get that appointment?
If you've got a pre-booked appointment, that still stays. This is just an additional service that we're introducing from next week to allow you to book your appointments with your GPs and clinicians. So that could be the clinical pharmacist, that could be the nurse practitioners that we also have on site.
And you also mentioned in the presentation things like the access to the NHS app and your System 1 online services, where some people might be used to logging on and ordering their repeat prescriptions or anything like doing other things through that portal. They still stay the same. They can still access those services even with Rapid Health.
Anything you currently have access to remains the same. With those, you do need a password. With this service, you don't need a password. So it's cloud-based. And then what verifies you is the details, your name, your date of birth and your postcode.
That's great. So if I do a search on, it feels like question time, this, isn't it? So if I do a search on Rapid Health and I'm putting all these searching, and what is wrong with me, I feel it's wrong with me, my symptoms just aren't coming up in that pre-formatted list. What can I do then?
So if there is a general history pathway as well, so you can click on that one, which will ask you some questions to give us a bit more information as to what you're worried about, what symptoms you might have, what might need, what you're worried that it might be, what you think you need, and that will be saved to your record, and it goes to what we call a smart inbox for the duty GP to review, and then they will send you a link in order to book an appointment, depending on what they feel, who could help you and when.
That's good. It's reassuring that a clinician views it at the other end, isn't it, rather than it just going into a black hole.
It doesn't go in. So if you're not sure, please use the general history and we will review and make sure that you are seen in the right time, in the right place.
That's great. And what happens if I've made a mistake in my form and I've gone the way through and I've booked the wrong time, the wrong day, and I'm panicking thinking, oh my goodness, do I have to put another form in? What do I have to do?
So it's really easy to double book yourself. So in that email that you get from the confirmation of the appointment, there is a little link in there that says cancel or amend your appointment. So if you've made a mistake completely, you can just cancel it and you can start again and submit another pathway, and it will offer you the appointments available for that problem. If you just want to amend it, it will show you the available appointments for the current pathway that you have chosen and the answers that you have given. So there's always a way around it. If you're really stuck, give us a ring.
That's great. So what happens if I've got multiple concerns? That usual story, the GP will only got time to talk about one thing. How should I handle that if I've got multiple things I would like to contact the practice about?
That's a really good question. So as a GP, it is really challenging sometimes to be able to manage 2, 3, 4 problems safely in the time that we have, which is 10 minutes. And we try our best, but it doesn't feel okay for either the patient or the clinician. I would really encourage you, just fill in another form. It may be that all problems don't need the same appointment. All the problems that you are worried about, some of them might not need an appointment at all. They might just need some advice or a different organisation. So our pharmacists in the community can be really helpful for some issues. We've got a minor ailment scheme. We've got an eye clinic. There are lots and lots of different people in our community who can help us. And I think just fill in another form so that we can direct that problem to the right appointment or the right service. Yeah, that would be my advice.
That's good. I think it's probably worth us going over it so people who maybe join partway through about on the 1st of October, what will happen? How will I get to this magic form that's going to give me an appointment?
Yeah.
Sorry, I was only come in there. So we are going to put the link live on Monday the 30th of September. It will go on after 5:30 onto the website. So the link is going to be available for patients and they will have access to the system for any appointments for the remainder of the week. We have purposely, because we are launching a new system, not pre-booked many appointments. So this enables people to start using the system and get used to it. So it will be available from Monday the 30th of September.
That's good. So people will be able to, and I think you'll have adverts in your practices with QR codes and maybe business cards with the QR codes and the links onto handouts. People can keep them for reference and use it in that way. And I think it's worth pointing out is you can be used on a laptop, an iPad, a phone, any kind of magical device you might have that can access the internet. I'm pretty sure that it's compatible with. But for those people who can't, they can still phone. But I think you'd want to encourage as many people who are comfortable with using online and have access to use it that way, because actually we know from evidence that people who fill the form out themselves, they put in a lot more information than actually when they go over it over the phone. Our team are very good and they're learning it and they'll be brilliant, but that it's much better if you can take the time to fill it out yourselves and provide that information up front for the GP who's either going to review it or so that the pathway can put you through to that the right appointment for you at that time. Now, I think I've come to the end of all the questions I had that were primed. Maxine, Dr. Ahmed, can you think of any other questions that we might not have covered? I'm just scanning back up to see if there's anything I think I've missed.
I don't think so. I think just to reiterate that staff have received lots of training, so they do have lots of information. So the remainder of this week and up to we go live on Monday, please do ask any questions if you're in contact. We have put a message on our phone system to let people know and that there is a new system coming, and all the information will be on the website as well as handouts, patient information leaflets. We have it all ready to start giving patients all of the information on how to use this new system.
Yeah, and we'll have available, before we go live, we'll have available the frequently asked questions on the website, and I'm sure available in practices for patients to have a look at. And I'd really encourage you to have a read through those questions we didn't think we need to answer. I think we might have answered on those. But equally, if you find something that we haven't answered you think would be useful for everyone else, please, when you're speaking to the practice, or drop us a message through an admin query on the system and let us know, and we'll get those added in for everyone else. And we're looking at some other resources that we can provide to try and help people navigate through the new system, because it's new and it's change, and we want to try and give people the tools to do that. But if in doubt, please don't suffer at home. Please give us a call if you're getting stuck on the system. But I think one last thing I was going to say as well is it's really important that you get your name and date of birth and your postcode correct. Otherwise, you will get a pop-up saying it doesn't recognise you, please call us. So sometimes it's easy to put, if you're called John Charles whatever, but actually you're known as Charles and we have you down as John Charles, make sure you put it in the right format for us to be able to find you on the system, to make sure it's with the right record. But any problems, please alert the team. But I think in other areas that we've launched this, it's been very welcome, and people have been quite excited about being able to go through and book the appointments at the time convenient to them. So any last comments from you, Dr. Ahmed and Maxine?
I think the main thing was we could see that current system doesn't work, It doesn't work for our staff, it doesn't work for our patients. And whilst change can be challenging and it's new, I think we're all really excited for this change because we can see how it will help us do the job that we really want to do, which is help our patients. So yeah, I would, if you're able to go online, please use the service. It allows our staff to help those who might need more assistance, who aren't able to go online, who haven't got access, who are vulnerable. And I really, I'm looking forward for our patients to be feeling a bit more confident, a bit more relieved, and not start every consultation with I wasn't able to get an appointment, which we want to be able to help you, and that's what we're here for.
That's great. And I think on that note, we will say thank you very much for everyone who watched and anyone who's watching after we've recorded this. We hope you will enjoy the system, and I hope it works well for everyone. And I think it's important to say in a few months' time, maybe in the new year, we'll be doing follow-up Facebook Lives to see how it's going and get patient feedback again then. So thank you for your time today. See you later. Goodbye.
Bye.